Senate Bill 228 is one of the most meaningful pieces of legislation that I will work on this year. You may have read before, suicide is a national epidemic, and Michigan's suicide rate is increasing at an astonishing 33% over a little over a decade. Michigan leaders often surmise we know a lot about this population's depression, mental illness, addiction, hopelessness, and suicide already. However, there are some facts about suicide you may be surprised to learn. First, suicide is not increasing in every state. As data from the CDC shows, although suicide is increasing nationally, in a few states, the suicide rate is actually on decline. A second fact you may not realize is that half of the people who die of suicide have no diagnosed mental health condition. Intentional drug overdoses account for only 1 out of 10 of all suicides. And in Michigan, there are more deaths by suicide each year than traffic or gun deaths combined. These facts challenge a lot of our assumptions about suicides. The fact that the majority of people who die by suicide have no mental health condition or drug addiction is not the story we often associate with suicide attempts. We may think we know a lot about who is committing suicide and the reasons why. Did you know that in Michigan, there are substantial increases in suicides in rural areas, in working populations, and within certain occupations? Did you also know that suicide is often correlated with a combination of job loss and the loss of a relationship? The reality is that often those who die by suicide were reliable workers, parents, and seniors with no known mental illness. These dynamics, coupled with Michigan's dramatic increase in suicide rates over the last decade, underscore our need to thoroughly research the causes and demographics of those who attempt suicide in our state and develop a state action plan. To turn things around, we need accurate and extensive data. That is why I introduced Senate Bill 228. This bill will bring education and data together under the direction of a commission to examine the data, make recommendations, and ensure proven solutions to get buy-in and implementation statewide. There is currently a patchwork of efforts across the state. For example, we developed a suicide prevention curriculum for Michigan schools under DHHS, but the curriculum was never implemented across the state by all of our ISDs. The commission will work in subcommittees to make sure that we are utilizing evidence-based programs for our schools. Another example, we have national data showing what works for treating PTSD and depression for veterans. However, I'm told that not all of our VAs or veteran services are using that work. This commission can help ensure that all of our veterans are getting access to what is working. Another example is law enforcement in the Lansing area have an opportunity to participate in what's called Lifesavers, which includes training for crisis intervention, works in partnership with local health departments, IDS, and community health. If this is a successful model, we need a way to share the success with the rest of the state. That is another job this commission can undertake. One more example, we have an excellent federal grant-funded suicide prevention program in Oakland County Community Mental Health. Oakland's success needs to be shared with the rest of the state. Commissions are often criticized for being ineffectual and perpetuating themselves. For this reason, we have put a sunset on this commission of 4 years. We directed the commission to work in subcommittees and with executive committee in charge of making sure objectives are accomplished on a timeline. Members of the commission will serve without compensation, and my office has been deluged with calls of support and interest from around the state. We have an overwhelming support and enthusiasm to tackle this crisis in a statewide, all-hands-on-deck approach. And I can't convey how important this is to me personally and how much I appreciate the Senate's support of this bill. Establishing this commission with this timely legislation will go a long way to reversing these heartbreaking trends and to change the Michigan story.